Compartment syndrome is a condition where the pressure inside a muscle compartment, a tight group of muscles, nerves, and blood vessels surrounded by a tough membrane, becomes too high. Imagine blowing up a balloon inside a small box. The box pushes back and squeezes everything inside. In the body, this extra pressure cuts off blood flow, which can damage the muscles and nerves if it is not quickly relieved. The main things that can cause this pressure to rise are a broken bone, especially in the leg or forearm, that swells or bleeds inside the compartment, a crush injury, like a heavy object falling on a limb, a tight cast, splint, or bandage that does not allow the swelling to expand, severe burns that cause swelling, very intense exercise or prolonged leg press workouts that cause muscles to swell quickly. Each of these situations adds volume inside a closed space, raising the pressure. Typical warning signs are easy to notice if you pay attention. Pain that feels much worse than the injury would suggest, especially when the limb is moved or the muscle is stretched. Think of trying to bend a sore toe after a sprain. A feeling of tightness or fullness in the limb, like a shoe that is too tight. Tingling, numbness, or a pins and needles sensation because nerves are being squeezed. The skin may look shiny and feel stretched, and the pulse may become weak or disappear. If any of these appear, especially together, think of compartment syndrome. Doctors first look at the symptoms and check the pressure with a thin needle attached to a pressure monitor. A reading above 30 to 35 millimeters of mercury usually signals the problem. Imaging X-ray, MRI isn't needed for the diagnosis, but can show the underlying injury. The urgent treatment is a surgical cut called a fasciotomy, where the tight membrane is open to let the pressure drop, much like cutting a tight plastic wrap to let steam out. Before surgery, the tight cast or bandage is removed, the limb is kept at the level of the heart, and the patient is monitored closely. You can help prevent compartment syndrome by making sure any cast, splint, or bandage is snug, but not overly tight. You should be able to slip a finger under it. Checking the injured limb every few hours for increasing pain, swelling, or numbness. Raising a swollen limb just enough to reduce swelling, but not so high that blood flow is cut off. Getting medical help quickly after a serious fracture, crush injury, or severe burn. These simple steps keep the pressure from building up in the first place. New research is making diagnosis and treatment faster and safer. Portable handheld devices now let doctors measure compartment pressure at the bedside in seconds. Some hospitals are testing near-infrared spectroscopy, a non-invasive light sensor that can detect reduced blood flow before pressure gets dangerously high. There are also minimally invasive fasciotomy techniques that use smaller incisions, leading to quicker healing and less scar tissue. These advances aim to catch compartment syndrome earlier and reduce the need for big surgeries.